virtual Make It Monday forum. And, our hope is that sometime in the next, maybe even 6 weeks, that we can start introducing face-to-face events as case counts and restrictions allow. But for now, we sure appreciate you folks sticking with us through the virtual events. And my thanks to Tasha and staff for still adding great content to our Make It Monday forums. So as we move ahead, again, I'd like to thank North Rim Bank, and this is one last time to thank them for sponsoring first quarter 2021 Make It Monday forums. They've been a stellar supporter of the Anchorage Chamber of Commerce, and I'm glad they took advantage of this great opportunity to promote North Rim Bank and be a sponsor of our forum. So, again, a big thank you to North Rim Bank for their support over the past few months. So, as far as our speakers today, we will have Dr. Sar Medoff join us a little later for the main presentation. And I'd also like to welcome Sky Nevada from the Anchorage Citywide Career and Job Fair Coalition. Today, Dr. Medoff will give an overview of the science, safety, and what to expect with COVID-19 vaccines. If you have any questions at any time during the forum, please type them in the Q&A box and we'll get to them at the end of the forum. So before we go into our main presentation, I'd like to welcome another stellar volunteer, with the Anchorage Chamber, and that's Sky Nevada, to tell us about the Citywide Career and Job Fair. So Sky.
Thank you so much, Bruce. It's so great to be here on a Make It Monday forum. Tasha and everyone on the staff does a great job of putting this together. So I'm very excited to tell you all about the Anchorage Citywide Career and Job Fair. This is our 3rd annual job fair we're hosting, and we are switching it up this year. We're going completely online and virtual with a new platform called Premier Virtual. It's a really beautiful platform. We're really excited about it. This year, we're hosting it on April 28th and 29th. That's Wednesday and Thursday. We have 2 sessions each day so we can prevent that screen fatigue that I know we all get from having a lot of these meetings. So we've broken it down into a 10 a.m. to noon and then a 2 p.m. to 4 p.m. That way we can have a little break in between and we can still enjoy our screen time together. This year, as I mentioned, we're going completely online with Premier Virtual and holding it over 2 days. We do still have booths available for $175 right now through Wednesday. After that, on April 1st, it does jump up to $200. Last year, we had over 1,400 job seekers come and join us for a job fair. It was absolutely amazing with over 100 employers. So space is still available. And this year we're not limited by any physical boundaries. So everyone is welcome and we're very excited. I've got a little video here to share with you today. Let's see, and then we'll watch that.
Mark your calendar, it's going to be the last major job fair of the season. And this year, we're going virtual. The Anchorage Citywide Career and Job Fair returns April 28th and 29th. Click the link in this post to register, set up your profile, and familiarize yourself with the virtual platform. The Anchorage Citywide Career and Job Fair, Wednesday and Thursday, April 28th and 29th.
As you can see, we're very excited about our job fair. We've got a lot of different coalition members that help put this together. People from the Muni, UAA, APU, the Anchorage School District, the different tribal organizations have come together to all help support keeping Alaskans working. And that's one of our main goals right now, is just to keep Alaska working. So we hope to see you at our job fair. I'll drop the link to register in the chat. And thank you so much for hosting me today.
Well, Sky, thank you very much for that presentation. And it looks like that's an event that the Anchorage Chamber will be attending, as we're looking to fill a position for a sales assistant for both our events and membership side of the house with the Anchorage Chamber. But yeah, you'll probably see us there. So thank you so much. Okay, now it's time for our main presentation. Dr. Sar Medoff is an emergency medicine specialist in Anchorage, Alaska. Dr. Medoff received his doctorate of medicine from the Icahn School of Medicine at Mount Sinai after receiving his master's degree from the Harvard Kennedy School and his Bachelor of Arts from Princeton University. Dr. Medoff is currently a staff physician for the State of Alaska Department of Health and Social Services Division of Public Health. So please join me in welcoming Dr. Sar Medoff.
Thanks for having me, Bruce, and thank you, Chamber of Commerce. It's a real privilege and pleasure to be here with you today. The only piece missing, Bruce, thank you for the introduction. I also work as an emergency medicine physician in Anchorage. I work at Alaska Native Medical Center, and I work at Providence as well. So I hope to never see any of you at work, because it's always much more fun to hang out outside of work. But thank you for having me. I really appreciate it. So today we're going to be talking about the science behind the vaccines, answering questions, because ultimately that's one of the most important things that I can do that you can't just get from checking our website online or anything else like that. But so we're going to go through some of the science. One thing that happens during many of these presentations that we've given is that people have a lot of questions about logistics and kind of how do I get my shot, how many vaccines are being shipped to Anchorage, so on and so forth. I'll answer them as best I can, but really as one of the physicians on the team, my area of specialty is the science and the science behind the vaccines. So let me go ahead, I'm gonna share my screen and we'll go through a quick slideshow here. I also wanna apologize in advance that the slides do have a lot of text, but I will try to highlight the key take-home points and make sure that we're, again, leave plenty of time for Q&A. So Bruce, if it's possible, I'm happy to share my screen here. It says disabled right now. Great, all right, there we go. Got it, awesome. Okay, so Tony, give me a thumbs up if you're able to see my screen. Awesome, okay, so COVID-19 vaccines, overview of science, safety, and what to expect. So the 5 key points that we're going to be going over is, number 1, the vaccines, not only are they safe, they're incredibly efficacious. These vaccines across the board prevent death due to COVID-19 illness. These vaccines, they also prevent most illnesses. And when we did the trials, when you hear studies, when you hear the numbers about the efficacy of these vaccines, what we're really talking about is symptomatic COVID, severe COVID causing hospitalization and death. So not only do these vaccines do an incredible job of preventing death, but they also prevent most symptomatic and severe COVID. These vaccines do have side effects. Now, when we talk about side effects, it's not really a side effect of the vaccine per se, but it's your body's own immune system being ramped up to fight off COVID if you ever see it in the future. So we call them side effects, but really it's your body's natural reaction to the vaccine as your body is getting trained up to fight off COVID in the future. Severe adverse reactions are extremely, extremely rare. So we're talking on the order of 2 to 4.5 per million doses. Very rare. We'll come back to this point in a second. And then lastly, this idea that vaccines provide individual and community protection. It's not just about giving yourself immunity, but it's really immunity for the entire community. So first, let's talk about preventing death. As you all know, COVID, obviously, pandemic, 15 months going on now. And we have seen over almost 550,000 deaths around the country. Here in Alaska, we've done a remarkable job, and the government, the city of Anchorage especially deserves a lot of credit, and the state public health division also deserves credit for really doing an outstanding job of addressing this pandemic as soon as it was recognized and doing everything that we could as a state and as a community to keep COVID out and to keep ourselves safe. So the vaccines are a key part of this, and these vaccines, they do prevent death. In the studies in Johnson & Johnson, in Moderna and Pfizer, all of the studies, these vaccines were incredibly efficacious at preventing symptomatic severe COVID and preventing death. In the trials, there was no one who died during the trials after receiving the vaccine due to COVID-19. So that's, if you want to take home one key point, and when we talk about vaccines, it's easy to get caught up in the weeds of kind of, did they test positive afterwards? Was it a breakthrough case? Did they have the slightest symptoms? But ultimately, the reason for vaccines, the goal of vaccines, is to prevent severe illness and death. And these vaccines were incredibly efficacious at doing this. Again, Moderna and Pfizer, each 94.5 and 95% efficacious at preventing death. When we talk about vaccines, the goal that had been set for vaccines is around 60% efficacy. And so when the numbers were 94, 95%, they got double checked, triple checked, because it's such an incredible success. So these vaccines, they prevent death. Second, do these vaccines prevent most illness? And they do. You're looking at efficacy rates equal to or greater than 89%. There was actually a study that came out just this morning in the CDC, one of their weekly reports, where they showed that in over 4,000 healthcare employees who have received vaccines, that the vaccines, the real world efficacy is 90% or greater. So that's just remarkably effective at preventing symptomatic and severe COVID, which again, one of the key goals of the vaccine. If you put preventing death as goal number one, preventing symptomatic and severe COVID is number two. Incredibly, incredibly efficacious at doing that. These common side effects. So as an ER physician, I was eligible to get the vaccine back in December. I got it along with a number of my colleagues who work with the state, who are also emergency physicians. That's why we were able to get it when we were. And I can tell you from my personal experience, which I think has been borne out in much of the literature, the following day, I had a slight headache, a little bit of muscle aches and chills. I took a Tylenol. I felt well enough to work my shift that night. And so, yes, there are side effects to the vaccines, but let me go back to what I said initially, that these side effects that we see, it's not really a side effect. It's not the vaccine causing these symptoms in your body. It's your own immune system ramping up to fight off COVID in the future. The way the vaccines work is they present a small protein that's on the outside of the coronavirus. It's the spike protein. They present that to your body. Your body's immune system recognizes it and says, hey, I've never seen this before. This looks like an outside protein. Maybe it's dangerous. I'm going to build a defense against it so that in the future, if you ever are exposed to the real COVID, that your body knows how to recognize it, wall it off, and keep it out and fight it off. That process of building that defense mechanism, that's what causes these muscle aches, headache, sometimes a low-grade fever or chills. As for pain at the injection site, you will have a sore arm. It's about 80% of everyone in the trial, but that's across the board, both for people who got the vaccine and people who got a placebo of just salt water injected into their muscle. Injections aren't any fun, but if it can save a life, totally worth it. And I'm happy to answer questions about these side effects as well later on. Happy to answer questions about all of this, so don't worry, you will have a chance. This idea of severe adverse reactions are rare. It's not just an idea, it's been borne out by the science at this point. So obviously in Alaska, we had the unfortunate distinction of being the first place to have an anaphylactic reaction to the vaccine. It was a nurse in Juneau who was in kind of that early wave of getting the vaccines, and she did have an anaphylactic reaction to the vaccine. She had no history of anaphylaxis, no other allergies. But what I can tell you is that these events are incredibly rare. When we talk about how rare they are, again, for Moderna, it looks like it's about 2.5 per 1 million doses. And for Pfizer, it's closer to 4.5 per 1 million doses. Again, real numbers, and I don't want to minimize the significance of any severe reaction, but I do want to say that these are, if it's 4 out of every million doses, that's extremely rare. Also at this point, we've now seen over 100 million doses given in the US. And in addition, there are over 300 million given worldwide. We have a lot more data than when we first started seeing numbers around COVID-19 vaccines. The initial trials had about 75,000 participants between Moderna and Pfizer. 75,000 is a lot, but at this point, millions and millions and millions more data points than what we had back in December. Lastly, this idea of vaccines providing individual and community immunity. This is ultimately part of the reason that I'm here today. It's part of the reason that all of the physicians working with the state of Alaska are out doing these talks to various communities, community councils, chambers of commerce. It's because getting my vaccine, it feels good. I feel extra protected because of it. But ultimately, the vaccine is not about providing immunity for myself. It's about providing immunity to my 2-year-old son at home, to my pregnant wife at home, to my parents who are over the age of 65, who I want to be able to see and spend time with. It's about protecting myself, but it's about protecting everyone else who I come into contact with. And even those who may not be my direct family. It's the idea of immunity for the community. And so getting your vaccine, if you happen to be a 30s, a white male in your 30s with very few medical problems like myself, sure, the chance of getting extremely sick from COVID is real, but it's small. However, by getting the vaccine myself, it's not even about protecting me, it's about protecting everyone else who I may come into contact with. And so when we think about vaccines, when we think about immunity, it's community immunity. It's not just about protecting myself or yourself. It's everyone else who you come into contact with. I'm going to go through the next slides kind of quickly, but I want you to know these are the 5 real take-home points. 1, vaccines prevent death. 2, they prevent most severe illness. And again, we're talking about 89+%. They do have some side effects as your immune system builds a response and a defense against COVID. Severe allergic reactions are extremely rare. And then these vaccines, they will protect you, but they will also protect those you love and the greater community around you. At this point, as of, I believe it's now been 2 or even 3 weeks, or even longer, that everyone in Alaska aged 16 years and older is now eligible to get a vaccine. So Pfizer and Moderna and Johnson & Johnson, all approved. By scheduling your appointment, you can actually, if you have a strong preference between the two, or if you need to schedule your second appointment, we're able to help accommodate that. Pfizer is the only one approved for 16 to 18, but again, anyone 16 and older in Alaska is able to register and receive a vaccine. So the vaccines, when are you considered immune? Like I said, these vaccines work by prompting your immune system to build a response. It does take a little bit of time, and so you are considered fully vaccinated 2 weeks after your second dose, if it's a 2-dose series you're doing, or it's 2 weeks after the 1 shot if you're doing Johnson & Johnson. The CDC has already put out some guidelines around what fully vaccinated people can safely do. So now we know that if you're fully vaccinated, it's safe if you have another friend who's fully vaccinated. You can have that dinner party that you've been waiting 15 months to have, and you can have that dinner party without wearing masks or socially distancing. If there's another family, even if they're not fully vaccinated, you can still spend time with them. But you know, the general guidance, and I'm sure you've all heard this is one of the main questions we get, is do I still need to wear a mask if I'm out in public? The answer for that is yes. We don't know, that other person in the supermarket or the other person who might be waiting in an office with you. We don't know if they're vaccinated or not. So we do still recommend that when you're out in public, if you don't know if everyone around you has been vaccinated or their vaccine status, you should still wear a mask. You should still socially distance. However, again, if it's your neighbor, your family member, a friend, if they're fully vaccinated and you're fully vaccinated, we do have some good guidance from the CDC around what you can safely do. The way I think about a vaccine, it's kind of like wearing a permanent mask. It's one step, it's one layer of protection, preventing you from getting COVID and from transmitting COVID. It's not foolproof, it's not 100%, it's 95% or 90+ based on the CDC evidence from today. It's great, but it's not 100%. And so it's one more layer of protection that you're kind of wearing all the time. The vaccines are tested. I'm happy to come back to this if people would like, but the long and short of it is that the vaccines still went through the same 3-phase trials that every vaccine and every medication goes through when it's being tested for both safety and efficacy by the FDA. So the vaccines, there were no shortcuts, nothing was, there were no steps that were skipped in the testing process, both for safety and efficacy. It did go fast. And a lot of that reason was because of the money that the government paid to the drug companies up front, kind of guaranteeing to buy a certain number of doses. But no steps were skipped by the FDA as they went through the safety and efficacy trials for these vaccines. One vaccine people ask, is one vaccine better? The right answer right now is whichever vaccine you can get, that's the best one for you. Here in Anchorage, we are incredibly fortunate to have all 3 vaccines available. Again, it depends on your pharmacy and kind of what's most convenient for you. But which vaccine is best? Whichever one you can get soonest. That's the answer. The vaccine safety, we continue to monitor it. VAERS and vSafe are 2 databases run by the CDC tracking any side effects, symptoms that people have after the vaccine. So like I said, we now have millions and millions and millions of shots into arms, which is great, but we are still gathering data. We are still collecting safety data just to make sure, to make extra sure, double, triple, quadruple check, millionth time check that these vaccines are safe, which we think they are. Like I said, we have more data on these vaccines than almost any other vaccine out there. And at this point, everything shows that they are safe and efficacious. This may be the most important slide. I know I said that about my first slide, but really, this is the one. If you're going to take notes on this presentation, covidvax.alaska.gov, or you can call 907-646-3322 if you want to talk to a real human being in order to schedule your appointment, or if you have questions about the vaccine that I'm not able to answer for you today. You can either go to this website to schedule your appointment, you can call this number to schedule your appointment, but it's not just about protecting you, it's about protecting everyone you love and everyone who you may come into contact with. It's immunity for me, it's immunity for you, but it's really about immunity for the entire community. And that's what we're going for. So with that, I'll stop sharing the slides here, but I hope we still have time for a little bit of Q&A. So I would love to take your questions and try to give you the best answer that I'm able to. Thank you for your attention today.
Great, thank you so much. We do have a couple questions to kick things off here. For those, if you do have a question, type it in the Q&A box and we have plenty of time to get to most of these. So let's see. First question, will people need to get a COVID vaccination every year?
Great question. And right now, so I don't have a definite answer. Right now, I personally am planning on it, just in the sense with what we're seeing for variants. So you may have heard that there are multiple variants out there, B117, which is the UK variant. There's B1429. There are other variants out there. Now, all viruses naturally mutate. Variants are expected. It's part of the reason you have to get a different flu shot every year. So right now, all the vaccines that we have seem to provide great protection against the variants that are out there right now. However, there may be new variants that may come up in the next year where we may need to get a booster. And so whether it'll be every 1 year, every 3 years, or every 5 years, it's a little too early to say, but I do anticipate that I think we will be needing boosters somewhere down the line. I don't know if it's going to be 1, 3, 5 years, but I do expect that we will probably need boosters just at some point to address new variants as they arise.
Yeah, that makes sense. Okay, and will vaccinated people still carry the virus and potentially spread to unvaccinated people?
Great question. So right now, the best thinking we have, and we have some data out of Israel as well as from the CDC report today, it looks like that when we say that a vaccine is 90 or 95% efficacious against preventing severe and symptomatic COVID, it looks like the efficacy is very, very similar in preventing you from catching COVID at all, in terms of preventing you from getting that asymptomatic infection where you could potentially transmit it to someone else. So to be clear, the vaccines themselves will not cause a positive COVID test. They don't have any part of the inner COVID virus that actually makes you sick. There's no part of that in the vaccine itself. However, with the vaccines, they are 90 to 95% efficacious. And we think that that efficacy is similar in preventing that asymptomatic infection where you could potentially infect others.
Okay. Will there be a vaccine for the youngest population under 16?
Yeah, great question. I see, Jackie, that you asked that. Thanks for asking that. So right now, the studies are ongoing and they've actually been enrolled for ages down to 12 years old. So that was the next group of youngsters that were enrolled in these trials. So if I had to guess, in the next couple of months, again, maybe it's 6 months or so before that data is out and put before the FDA to get people who are 12 years and older vaccinated. I can tell you that they have also started enrolling trials. Both Moderna and Pfizer have started enrolling trials for kids as young as 6 months old. Wow. So really young kids, which is great because we want to, again, protect everyone. But those trials just started enrolling in the past couple of weeks. And so realistically for that, you're looking at 6 to 12 months probably before we get the data from that. Now, I want to say there, from a scientific standpoint and a theoretical standpoint, these vaccines should be completely safe for children. We think that they are and have no reason to suspect otherwise. But again, we're going to wait for the data before the FDA makes that call and approves it for the younger age groups.
And there was a note in your slide about the Johnson & Johnson vaccination studies and how they were done later in the pandemic. They're not comparable to the others. Can you elaborate more on that?
Yeah, Joshua, thanks for asking that. So it's true, the Johnson & Johnson studies were done later in the pandemic. It was the most recently approved vaccine in the group. And so one thing that you saw in this trial is that the efficacy numbers in terms of preventing symptomatic COVID were a little bit lower. Again, on the order of 74, I think it was 74%. Don't quote me on that number, but 74%, and then kind of that 89% efficacy of preventing severe COVID causing hospitalization. Part of the reason for that is that when we look at where the trials were done, so for example, the Johnson & Johnson trial was done really in 3 different locations around the world, one of them being South Africa. There was a higher level of COVID in the general population than what we were seeing during the Moderna and Pfizer trials. What that means is that, basically with more vaccine circulating around the community, there were more chances for people to get infected with COVID, whether it was within that 2-week period for Johnson & Johnson, kind of before it was fully efficacious, or if they were in South Africa or some of the other places where there may have been more variants, so say the UK, for example, it wasn't targeted quite as closely to those variants. We think it still provides a great protection overall. And like I said, the numbers that we have for efficacy do take into account all of the variants that people were exposed to during the trial, but the efficacy was not quite as high as Moderna and Pfizer. The one thing to keep in mind, though, is because they were done at different times and in different places and with a different mix of variants, it's not quite exactly comparing apples to apples when we compare Moderna, Pfizer to the Johnson & Johnson vaccine. So, efficacy, everyone likes to have kind of one number where we can say this is how efficacious the vaccine is, hard stop. And ultimately what we see is that, the trials, it's a little bit more like apples and oranges than apples to apples. And so until we have a trial, of all 3 side by side, we have to kind of take each one at face value and say, hey, we think this is incredibly efficacious, but the real world may be slightly lower than what we're seeing here. So for example, with the with Moderna and Pfizer and Johnson & Johnson, like with what the CDC put out today, showing that real world efficacy probably closer to 90% than the 94 or 95%. Still amazing and awesome news, but not quite the 95% that we saw in the trial, but that's okay. And that's to be expected. So I hope that answers your question, Joshua.
Thank you. Next question. In a month or so, it would seem that all folks that are concerned about getting COVID will have had their opportunity to get vaccinated. Why the continued need for mask wearing and distancing?
Oh, great question. And I wish I could say that after everyone who wants it has gotten it, that we're going to be in the clear and we'll be good to go. Unfortunately, right now, and what we're starting to run up against, we're not there just yet. Like you said, we're probably a month or 2 away from everyone who wants one just having one in their arms already. We're slightly above 40% of Alaskans who are eligible have received their first shot of a vaccine. So we're over 40%, which is great. However, to get herd immunity, the idea that so many people are vaccinated in the community that we don't have to really worry about the natural spread of COVID, that target's going to be closer to 70%, somewhere between 70 and 80%. We think 70% is that's what the CDC has put out as being a pretty reasonable target to get herd immunity for COVID. And so, right now we're around 40%. Look, I think that if 70+% of Alaskans who are eligible get their COVID vaccine, then I think we're going to be having a very different conversation about whether we need to be wearing masks and socially distancing. But the modeling and kind of our predictions and what we've seen in smaller settings. So for example, the nursing home world is that we're not seeing a 70% uptake of vaccines just yet. There is a lot of natural hesitancy. There are always going to be people who say, I don't want any vaccines. I don't want it for tetanus, for measles, mumps, rubella. I don't want any vaccine at all. There are always going to be those people. And we just don't know yet how large that population is going to be. And so until we hit about that 70% number, we're going to need to keep wearing masks. We're going to need to keep socially distancing when we're out in public among people who we don't know if they've been vaccinated or not. And the reason for that is that, again, anything under 70%, there's still going to be call it wild COVID out there among the population. There are enough people at that point that it will continue to replicate, and it may continue to mutate, and we may still see new variants, again, where the vaccine may be less efficacious. And so until we hit that 70%, that's about the level we need to be before we're not seeing new natural spread and we're not seeing new variants. So that's the target right now. If we hit 70%, then I will be eating crow while doing a happy dance. But if we're anything under that, it's going to be tough to let the masks and the socially distancing go when we're out in public.
Right. Well, that's
I'm
a good
glad you brought up.
Yeah.
Yeah, that's perfect, because that was what my question had to do with as well. As a panelist, I can't type it in the Q&A, so I'll pop on. About herd immunity, I work in oil and gas, and about 80% of my employees have said that they absolutely refuse to take the vaccine for whatever reason. They don't believe it. They think it's untested. They think that it's bad. They think it's unreliable. Does the state have any type of plan to try to combat that misinformation in order to hit that 70%? Because that's just my employees, and if 80% of them won't take it, I know a lot of the state feels the same way. So is there a plan to try to combat that?
Tana, I'm free all week long. You put me on a Zoom call with them, and I am happy to do another Q&A with them. So I can tell you that right now, it's part of the reason that I'm here. There is a whole team of physicians and other, we have a pharmacist as well, some other folks working with the state, with the Division of Public Health, to try and get the message out there, to try and dispel a lot of the misinformation that people see on social media. It's out there. Again, it started with microchips and, they're all any number of, I don't want to call them myths, but a lot of misinformation that you hear out there on social media. And it kind of comes in waves. And so each week I'm answering different questions about whatever the concern du jour is. The one thing I would say is that, and we're starting to see a little bit less of it, there were a lot of safety concerns at the beginning. We still hear safety concerns, don't get me wrong. But when the trials came out, again, 75,000 people, which is a lot. I can't count to 75,000, but it's a lot harder now. Now we're talking about millions and hundreds of millions of people who have gotten the vaccine and who have gotten it safely. And so I think at this point, the safety concerns are still out there, but it's a little bit harder because before people would say, for example, I love to go skiing, but I like to see my friend kind of go down that really steep run first. Vaccines are similar. And at this point, we are seeing a lot more people. There are more vaccines out there. And so everyone who is saying, I just want to wait and see, I want to see how, my friend does when they get their vaccine, that there is some momentum building in that regard. Again, at a few 100 million doses, it's hard to ignore that this does appear to be safe and efficacious, but it just takes a little bit more time. The one thing I would say is that for any group that, if I can get more than 3 people in a room, realistically, if I can get anyone in a room, I'm more than happy to answer their questions, do a Q&A. We've been doing lots of these. It started with nursing homes and assisted living homes because they were the first group where vaccines were rolled out to. And so I would say every week we're doing 4 to 5 Q&As just like this, kind of an hour-long presentation, answering questions from the staff who were very hesitant and also from family members, trying to answer their questions because again, these in this day and age, there's no Walter Cronkite anymore. It's tough to know, who you can trust for your information, who you can ask and say, hey, I heard this from my crazy uncle. Is that true? And so we're trying to get out there and answer these questions. And like I said, if there is a group that would like someone from the state to come out and answer questions, we are more than happy to do it. That's why I bring Tony to these presentations so that he can help schedule them. And but yeah, thank you for asking that. And I think it's a great point that there are still pockets, and for a while there are going to be these pockets of hesitant and resistant folks who are, for whatever reason, and many times for good reason, they are concerned about getting the vaccine. And so we want to do everything that we can to address the misinformation and help answer any questions they may have to bring down that barrier to vaccination.
Great, thanks. We do have a couple more questions here. How long are COVID antibodies effective in a person's body?
Great question. So right now, we think that by having had the COVID, let's say you had an infection with wild COVID, with the original COVID, we think that you have some measure of immunity for somewhere between 3 to 6 months. So that's good. However, being infected with COVID and subsequently recovering, we think that that really only gives you strong protection against that one strain of COVID. It actually doesn't give you too much immunity against these variant strains that we are seeing a little bit more of. The vaccines appear to give you immunity against both the original COVID, but also many of the variants. And so that's one of the reasons why, even if you've had COVID, you should still get a COVID vaccine. The second thing, the reason why we do 2 shots for the COVID vaccine, the first shot builds your short-term immunity, and that second shot is what really cements it in kind of your long-term cell immunity. That's what teaches your immune system that, hey, I might see this infection not just 2 weeks down the line, but I might see this months and months down the line. And that's how you teach your immune system to have a longer immune period from COVID. We don't yet know whether it's 6 months, a year and a half, or even longer. I can tell you that everything we're seeing is that it appears to give stronger and more long-lasting immunity than having had COVID and recovered naturally. So getting the vaccine does appear to really boost that immune system and let you both be protected and fight off infection in the future for longer. And I would say, 6 months again is kind of the shorter end of the spectrum, and maybe even longer. We don't know exactly how long yet.
Interesting. And do you know what the vaccination percentage among the most vulnerable population is?
It's a good question. So when we talk about the most vulnerable population, the area that I focus on within the Division of Public Health is I do a lot of work with nursing homes and assisted living homes. To give you a ballpark figure, that within the assisted living home and nursing home community, we're looking at between 70 to 80% vaccination rate for residents. And it may be even higher than that, but there are a few outliers where it's a little bit lower, but the vast majority, on average across the state, we're looking at somewhere 70+% among those who are in assisted living facilities. Now, there are other populations, though, that are incredibly vulnerable and incredibly at risk. So folks with intellectual and developmental disability are at high risk. Again, they've been eligible for the vaccine. They were kind of in that second tier where they were able to get it. But I don't know what the vaccination rate is there. Like I said, I can tell you we're doing lots and lots of outreach and trying to get the vaccine out there, targeted at the vulnerable groups. But what we've actually seen is that once the state opened up to everyone 16 and older, we saw higher rates, not just among the vulnerable groups, but among everyone. And so, before we kind of been marching it out tier by tier by tier, making sure we were reaching out to the vulnerable groups, but we saw some hesitation there. And a lot of times people would say, hey, I want to get it, but I don't want to get it if my son who takes care of me or my daughter who takes care of me, if they can't get it as well. And so once we opened up to 16 and older, we've actually seen even higher rates of uptake among the vulnerable populations now that their family members are also able to get it. So, I think that was an unexpected win, but it's been great. And I've been on national calls with Dr. Zink where she's been able to tell a lot of states where they're worried about, there being a rush or there not being enough for their vulnerable populations. And we say you actually see a higher uptake among vulnerable populations once their family members are also able to get it, which has been great.
Yeah, cool. Let's see, this might be the final question unless something else here pops up, but do you see a government issued vaccine passport in the future for day-to-day tasks like sporting events,
Sure.
concerts, air travel?
Sure, good question. Right now, we are not seeing a lot of, let's call it political movement towards a centralized vaccine passport. I know that there's ongoing legislation at the state level right now, kind of the ongoing session. But there is not a lot of movement on the state side that I personally have heard of, or in this work that I've heard of, towards getting either a state-based one. I think that a lot of people are looking to the federal government if something like this were going to roll out. But again, I haven't heard anything special about that. I would not be surprised, and this is kind of on a personal level and just reading the tea leaves a little bit, I would not be surprised if certain businesses, or certain industries start saying, hey, we want, if you show proof of a vaccine, you're able to do X, Y, Z, especially for things that may be in small groups or in enclosed spaces. I have not heard anything to that effect yet. I can tell you that, right now, personally, I'm working on guidelines for assisted living homes and nursing homes. And part of opening up for visitation safely is making sure that visitors and that the people who are being visited are vaccinated. And so we're trying to figure out kind of that balance and how we can do it, both protecting personal health information, but also protecting the safety of these vulnerable populations. So I don't have an answer for you. The quick answer is I don't have an answer about whether there is going to be one vaccine passport. I have not heard anything to that effect yet. But I also want to throw out there that I think there's a very real possibility that individual private businesses or certain industries may start requiring something along those lines, if they either have vulnerable populations or where groups may be at risk. So it's not it's not an official prediction. It's just kind of what I have seen reading tea leaves, and I make that sound like that's a hobby. It's not.
Great. Well, thank you so much. I think that's all for questions. So I'll hand it back over to Bruce.
Great. Well, thank you. And it's really interesting. A lot of the questions, Dr. Medoff, that you answered are the ones that I deal with friends and with family. And so I really hope you can get out to a bigger population, because you have just such a great knowledge of the effects of it and answering all the questions as far as the life of antibodies and all. And I'm happy to say 100% vaccination, with our family. I'm anxiously waiting next week for my second shot. But but in what you mentioned, there is some protection that comes after the first shot as well. It's not all or nothing with 2 shots.
Yeah, great question. So there is some protection that you get after the first shot. The studies weren't designed to look at what the protection was after just 1 shot. And ultimately, and I'm talking about the Moderna and Pfizer, because those are the 2-shot series. And they had the studies were run really well. And so pretty much everyone who got the first shot got the second shot. They didn't lose a lot of people during the trial. And so what they see is that the efficacy of only getting 1 shot, somewhere between 60% and 85% is what they think. Again, the numbers are kind of too small to be able to say where the true value lies in between there. It definitely gives some protection, and some protection is better than no protection. But, if you're in a 2-shot series, definitely, I know you will, but for everyone else listening, make sure you get that second shot, because that is really how we hit that 90+% efficacy.
Very good. Well, I hope that we see you again. I think you did a great job today, and if we can get you out to talk to more people and answer their questions, I think it's going to be absolutely the right thing to do. It'll get us to that higher percentage.
Thank you for having me, Bruce. Thank you to the Chamber for having me. Again, if you are part of a group or you know of a group that is interested in having a Q&A with myself or one of the other physicians with the state, we would love to come and talk to you. This is what we spend the vast majority of our week doing right now, but it really is a treat and a privilege to be able to get out there and get this message out and to answer the questions that so many people have. So please, please, please reach out, and we would love to come and talk to you and help get the information out there. So thanks so much for having me.
You bet. Thank you. And with that, I'd like to thank everyone for coming to today's forum. We've got some housekeeping items here, but in April, we will have updates on the Port of Alaska, the Anchorage School District, and more. Also in April, the Diversity Committee will be meeting on their new day and time, which is going to be the first Wednesday of the month from 3:30 to 4 p.m. via Zoom. The Young Professionals Group is excited to announce that the Alaska Young Professionals Summit has gone virtual via WOVA. So we can add this to our portfolio of social platforms that we'll be learning about. But I've seen some of the previews on WOVA. It looks like it's really good, and it's going to work out tremendously well for a virtual environment for the Young Professionals Summit. So join young professionals from across the state for a 2-day virtual conference to develop Alaska's workforce and prepare, motivate, and inspire attendees to be informed and productive leaders. For more information and to register for any of these events, please come to anchoragechamber.org. And lastly, mark your calendars. Citywide Cleanup presented by Matson is back, and it's for the whole month of May. There's information for sponsorships available, and you can email Katie Cole at events@anchoragechamber.org. And also you can register your team at citywidecleanup.org. And now to wrap up, we have our virtual door prizes. And the first prize is a free registration for any upcoming Make It Monday forum, courtesy of Stu Graham of MTA. And that goes to Tracy Williams. Well, Tracy, thank you for joining us. And second prize is 2 trolley tickets, courtesy of Anchorage Trolley Tours. And those go to a longtime veteran of the visitor industry, and that's Jeff Johnson with Raven, Alaska. So congratulations, Jeff, and thanks for joining us. If you'd like to donate a virtual door prize, please email Tasha at anchoragechamber.org. So from all of us here at the Anchorage Chamber of Commerce, have a great week, and thank you for your time.